the ballyhooed pat the half has been achieved. Um, Preliminarily, got those confirmations. We haven't seen anything really official on paper yet. But I know that Crystal had said that if the DoD numbers that they got last week are anything like they were last week, then yeah, we've achieved the vaccination of half of our adult population and then some, it looks like. Is that what you're hearing preliminarily this morning? Chima, good morning.
Good morning. Yes, yeah, it's the same information that we're hearing. Yes.
Busy week for you guys. It's Chima Mbakwem, ladies and gentlemen, the acting chief public officer for the Department of Public Health and Social Services. Just a week ago, there was a press conference, I think Thursday, right? And then we had Chima on this program, kind of making the call out to get for people to get tested, and the testing, which I believe they're continuing today. This is drive-through COVID-19 PCR testing for Subaki Tower, A-Class Lounge, and of course the general public. Up to 300 tests offered on a first-come, first-served basis from 9 to 12 at the old Carnival Grounds in Tijan Barragata. Chima, let's just get right into it. Status update on the clusters that you guys reported on last week. Where are we with the testing, the positives, the contact tracing, and all that good stuff?
Yeah. So we. Good morning, listeners. We're getting some favorable information from the testing. So in the past week, 7 days for 7 days now, we've actually tested 1,957 individuals, and we've been able to only record 23 positives from this number. So that means 1,927 of them are negative. And then we have 7 follow-ups from other cases, like people who had COVID and then we had to test them for other reasons. So the numbers are looking good from the testing, but it does not represent fully the numbers that we're looking for. So for those who recorded Subaki as their exposure site, we only have 862 people that have actually tested from the 1,243 that were initially identified. So we're still looking for a few more people that we intend to come get tested, so that we can have at least 80 to 90% of these individuals. But at the same time, people are going to their private clinics too to get tested. So I also believe that they are not all coming to public health, because we're seeing increased number of testing also with other clinics. So yesterday we actually had 158 people tested yesterday, and only 2 of them were positive. So basically we're still seeing people going out there to test, but we're still urging them to continue so that we do more active case finding to see if there's something going on. So in the next 2 weeks, we'll be able to be sure what actually is going on. So right now, we're still doing active case finding.
So as it stands now, we're not done sorting through these clusters, right?
The one thing about case investigation is that there's no end to it. It's consistent. So you might see a random case, and then you find out through interview it is linked to somewhere, and then you start all over again to interview. But the good thing is that if you're looking at the numbers and them not being so high at this point from the Subaki testing, that means the transmission in that particular setting has actually been cut off.
Chima, what can you tell us about this case with the 2 doctors who returned from India? I know Dr. Hoawen has confirmed that one of the samples will be sent off to the CDC. What do you guys know about this on your end of public health?
No, so on the side of public health, we're still doing what we normally do. We've actually, the team has spoken to them. We've actually interviewed them. we are looking at doing more contact tracing to identify those who might have been in contact with them and then have them quarantined and then tested. So it's all in control. It's not so much to be worried about now until we get more information.
Chima, so when you said that, because HOA said that the hospital's infectious control team also did contact tracing, is that a duplication of efforts, or do you guys, as in your role as public health, also have to go in and do your thing no matter who else has investigated it?
So like at the beginning of the pandemic, there was a lot of training with amongst partners, with public health. We did that with the schools. So we have a contact tracer. So the main thing is contact tracing on the side of the establishment is like the establishment would know the dates they were in the clinic. They would know the patients that were that came to them within that period of investigation. The establishment will be the one to identify visitors to that establishment. So what happens is that when this is completed, public health acts on this information. So it's a complementary effort, not duplication. Yes. So we, rather than a public health staff going to sit down there to do it, in some of these establishments, we've been able to train people with the skill set to actually do the interviews, but still public health is ultimately in control.
And so have you guys completed your contact tracing investigation into these two COVID-19 positive doctors?
It's still ongoing. We're still gathering information, yes.
So has anyone else been quarantined or isolated as a result of your investigation into it?
At this point, I cannot give you the exact information because I need to reach back to the team to find out who exactly has been quarantined. But people have been quarantined.
Additional people other than the two doctors?
Yes. And the interesting thing about these exposures is looking at the time of testing and the period of infectivity, you try to balance it. So even if you identify those individuals and quarantine them, you're not going to test them right away in some situations, So you have to wait for a certain period, but they all have to complete their 14 days of quarantine to make sure that the science is followed through.
Chima, because I know that you kind of call some shots with the quarantine and whatnot. So let me just ask, in the event of these two doctors, given that they were granted the exemption as essential medical personnel, did our system hold up? Was this a failure in that system, or does it just kind of come with the territory in a pandemic?
No, so your question would be, they came in with a negative PCR test, right? And then they arrived Guam, and then after a few days, they had symptoms, and then they went and got tested and turned positive. But you also have to look at it from this point that the COVID-19 test is a point-in-time test. So at any point you take that test, and it tells you your status at that point. It does not stop you from getting exposed and getting infected. Immediately you walk out of that place. So that's why the test is just to know your status at that point. And then moving further, we're saying if you test negative right now, it is not a certificate or it's not a reason for you not to follow public health guidance of wearing your face covering and then keeping safe distance, because at that point you just know that you don't have COVID, but we're still in a pandemic. There's still transmission going on in places, so you can test and then get infected. So for their own case, even when they tested negative, so that's a travel related test, so they could have tested negative, got on the plane, and then the source of exposure would have been any point between their travel or even on island. So the system we have in place. This is not to say that is not working. But these are those outliers that can happen once in a while, and then we're able to also catch it and then take care of it.
We had a comment, contact tracing the flight that the doctors came in on. Is that something that's happening?
Yes, yes. So, but the thing is, like I said, the you're going to look at the time that they tested and then count a few days back, because you're looking at a 10-day period for them to develop enough viral load to be detected by the test. So if I test positive today and you count 5 days or 6 days back, if I was on the flight 15 days ago, you won't bother about looking up anybody in that flight, because within the time frame it would have been up to 3 weeks, and even if I was exposed on that flight, at the point you're detecting the virus wouldn't make me go back to check the plane. So there's so much we put into consideration, but if there's a need to do that, we actually have a mechanism in place for us to do that.
Chima, so when you said that there were people who were quarantined because of exposure to these doctors, were those people from the hospital or the community?
So, like I said, I can't give you that breakdown, but I know people have been quarantined. But if you're looking for the exact breakdown, normally if you're looking at a case, you're looking at the close contact. You're looking at the concentric circle of that individual. So first of all, you're going to look at who are the closest to them. Those are the family members. So they're the first ones to be quarantined because they spend longer times with them. And then you move it up to the workplace and identify the workplace. And most times, like if you're looking at the clinics, the hospitals now have heightened alert for COVID. So the infection control protocols in the clinic is actually different from the home. So these doctors follow a strict regimen for them to see patients. So the patients are tested, they wear their mask. The doctors are in the hospital, they wear their mask, because first of all, you need to, working in the healthcare environment, you need to always wear your protective equipment, for yourself and for the patient. So part of it is that while the doctors are sick and they're trying to protect themselves from the patients, at the same time they're protecting the patients from themselves, if you look at it from that common sense point of view.
Yeah, well, Dr. Ho had said that GMH is currently using a 2-mask policy. So he said that these doctors are wearing 2 masks.
Yeah, but yeah, like I pointed out, so for every medical procedure, for any contact with a patient, there are infection control protocols that are laid down. Yeah. So I think the hospital is actually the safest place, for
Easy
you to
there,
be
Chima, because they did have a lot of exposure in the hospital last year.
No, at the beginning, because but if you're looking at hospital exposure, at that point it was not with the patient, it was
they were bringing it in. Room. Yeah, I get it. Yeah.
It was in the lunchroom, people who were having lunch together, and that is what you expect in workplaces. So that's why we actually investigate workplaces too.
Are you concerned at all that we're sending off a sample to the CDC to see if this is the India variant? And then where does the India variant play in with the other variants? Because I had Dr. Wen has sent me an advisory from the CDC, and let me just pop it up here, Chima, because I want to make sure I ask the right question. Background rationale and evidence for public health recommendations for fully vaccinated people. Preliminary evidence, so this is from the CDC website, guys. Preliminary evidence suggests that the currently authorized COVID-19 vaccines may provide some protection against a variety of strains, including B.1.1.7, originally identified from the UK, B.1.351, originally identified in South Africa. However, across studies, antibody neutralizing activity of sera from vaccinated people was still generally higher. I don't even know what that means. But I noticed they didn't list the India variant, is what I did notice. So how concerned are we about the India variant? When do we anticipate getting the results back? And should people be concerned about the India variant, and how bad is it compared to the other variants?
I think we should be we should be concerned all the time, because there's actually a pandemic. It hasn't been called off, and with these viruses, they keep mutating and coming up with various variants. So that's why it's still important for us to use those measures that we've been asked to use to protect ourselves. But being worried or being concerned is consistent with the pandemic because there's nothing cast in stone. It could change at any point in time. You're looking at even first world countries with all the sophisticated medical, all the sophistication and infection control measures that they have in place. They've actually been brought to their knees by the virus. So right here on Guam, we're doing very well, and this is with the commitment that the public health and the community has. So at this point, we keep saying, we're concerned, but people should keep doing what they're asked to do, which is following public health recommendations about, safe distancing and wearing face masks. We can actually get out of this.
Right. Chima, so what else is going on with you guys? I know that's a loaded question.
Yeah, no, we're good. We're still ramping up our immunization efforts. We have a lot of collaborations going on. We're collaborating with businesses. We're collaborating with the church. We're trying to make sure that we keep up the momentum to have more people vaccinated, because we're still looking towards getting this herd immunity that we're actually hoping to get in a few maybe weeks or in the next month.
Yeah.
But it's for the public to continue to come out to get vaccinated. We still have our vaccination clinics up at UOG. We're having a clinic today at the Southern Health Center
Right.
in Arahan.
Yeah.
And then we
In
have it
Alahan.
tomorrow. In Alahan, that's a new one.
I was going to charge you $50 for that.
Yeah, I'm still is
Yeah.
I'm gonna get it right the next
It is
time.
what it is, Chima. Don't worry.
Okay. All right. So we're actually hoping that we still increase testing, for active case finding in the community, so that we can react to those cases right away. And then we're also hoping that people will come out to get them vaccinated, so that we can have another layer of another layer of protection within the community.
Chima, I know you kind of explained it again, but it is confusing when you start considering the timeline of when someone was exposed to when they can be tested positive and how infectious they are in between. But we did have a comment. I don't understand, if the doctors contracted the virus from India, then why is it not a concern to test the flight?
So the determination to test is just not because they travel. So there are certain questions that we need to ask. There are certain scenarios that we need to play around. So if their infectious period is not within the time they are on the flight, then there won't be any need to test the whole flight. But if there's a determination to do that, like with what happened with the last case that we had on island, where we had the individual on board who tested positive. It was right there. We got the result right there. We were able to quarantine everybody that same night, made a determination on who were the close contacts. They are all in quarantine right now. Then those ones that were not, the individuals that were on the same flight with him, but that were not determined as close contacts, were let go, but also advised to watch out for symptoms and come to public health to get tested. So it's just not about taking everybody on the plane and having it. So there's a lot of work that goes into it, and I think public health has the training and the personnel that can make this decision. And we also have so CDC has the DGMQ, which is the Division of Migration and Quarantine. So they also support in the investigation. You know, this is an international flight. So if there's a reason for us to investigate that flight from origin, from India, DGMQ would actually help us determine who was in that flight, which country that they went to, in case they need to be contacted. So there's a system in place for airline investigation. And if there's a need for that, we would actually do that. And we've been doing it, and we've been coming up with good results.
Wow, that's pretty interesting. Chima, quarantine, right? So we've achieved the path to half. The physician advisory group has sent the recommendation for the quarantine over to the governor. What was the input from the Department of Public Health relative to new quarantine protocols?
You know, everybody has an input, you know, on how to make the everybody has an input about the quarantine and how best to make it work. But for us at Public Health, our main job is to make sure that whatever is being done is done safely and properly, you know, with the interest of the community and public health at large. So the population health is our interest. So whatever inputs, whatever decisions that are going to be made, excuse me, public health would be on the table to advise or to guide on those quarantine policies that will not be acceptable, you know, from our own point, and then we can put it out there. But the thing is that it is a joint effort between all parties that have interest in the quarantine. But public health ultimately makes the final, you know, decision on how those policies are going to be implemented. So there's one part about implementing the process, the policy. There's the policy side, and then there's the implementation side. So we just have to wait and then see how practicable most of those policies are, and then we can give guidance.
Right. Are you able to talk about the CDC guidance that came out the other day about fully vaccinated people not having to wear masks while outside and not in crowded areas?
So you know, so these are recommendations that are based on studies and based on information that CDC gathers, right? So, and most of these things are like you said, they are recommendations, and for you to take those recommendations, you also have to look at your capacity and your risk tolerance level, right? So, if you're looking at a situation where CDC is saying you can wear your mask if you're fully vaccinated outside, right? And our vaccination rate is 10%. That means if 10% of the island is vaccinated, then the risk level is higher because you're going to have 90% that is unvaccinated. Yeah. So these decisions the recommendations are made, and then the adoption and the implementation is based on your local situation. So right now we are looking at our situation and hoping that at some point, you know, we can adopt the recommendation. So what I have to put out there is, you know, a lot of people jump in and, you know, and read all these recommendations, you know, come to us, throw it in our faces and tell us, you know, this is a recommendation from CDC, this is a recommendation from WHO, and we also have access to that information too. So, you know, we even know before sometimes we know before it comes out.
Yeah.
So, you know, when people are telling me, you know, the CDC recommended, I'm like, yes, I know, but we also have to look at our local situation. Look at, we're still catching people in quarantine up to now who are coming into the island with COVID, right? But there's an international recommendation that everyone who gets on the flight from any international destination into the United States would have to test for COVID 73 hours before they come, 72 hours before they come in.
Yeah.
But Guam, because of our risk tolerance on the island, we're still going on with the quarantine, and we have evidence that people are still being identified in quarantine that are positive. So these are very good recommendations, wonderful recommendations, good for us to go back to normal, but this we should tread cautiously, before jumping into to implement all this without looking at our situation locally.
Thank you, Chima. I appreciate your
Thank you.
time, my friend. Keep us posted, okay?
Thank you so much for having me. Have a good day.
Always. Yeah, that's the okay. There you go. Chima Mbakwem, Chief Public Health Officer for the Department of Public Health and Social Services. I hope you guys are able to catch all that. There was a lot of information that he put out in this interview about the two doctors who had traveled to India and subsequently tested positive. He did reveal that other people were quarantined for exposure to these doctors. I asked him, "Hey, was it hospital related or community?" And he kind of alluded to it being more on the community side because he said, "Hey, who would be the first people to come into contact with these doctors? It would probably be their family." And so, if you kind of do the math in your head, it's easy to figure out what the answer is. We did have some comments in here.